Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we are talking about how to treat a double chin. Some people have a double chin genetically from a young age, and some people get it from weight gain. It often gets worse over time, and oftentimes people do not like how it looks, particularly in photos. So, what can we do about a double chin? In my consultation with patients about this topic, I discuss three options: Coolsculpting, Liposuction, and Kybella injections. And I'd like to go over those three with you today. First, let's discuss Coolsculpting for the under chin area. And if you are not familiar with Coolsculpting, which is fat freezing to reduce the fat bulge, then please listen to my podcast on Coolsculpting for more information. But briefly, Coolsculpting is FDA approved and has been done for many, many years, and the results are great. If the fat is large enough in that area to be suctioned into the Coolsculpting machine. So when someone comes in for a consultation, I measure them to see if they are a candidate for Coolsculpting, and if they are, I will usually recommend to do that first. It's easy, there is mild discomfort bordering on none, and there is no downtime. It's usually 1 or 2 treatments, occasionally more than that. And we usually use the Cool Mini applicators, either 1, 2, or up to 3 at the most. The patient is sitting upright during the treatment. It can last a few hours, usually 2. In my office, they just can watch TV, and it works incredibly well. In the under chin area, Coolsculpting is also FDA approved for skin tightening, and that is a common question. People will ask, if the fat shrinks, then will they have loose skin? And the answer is usually no, but this is where patient selection is really important. If someone is young and has good skin quality, I really have no problem with doing the Coolsculpting. I've never seen it be an issue. The skin really bounces back as the fat shrinks and there is no hanging skin. However, if it is an older person with a large area of hanging fat and hanging skin with thin skin, I've definitely seen issues, and it's been reported in the literature that you can reduce the fat and then you end up with more hanging skin. And so what is the point of doing that? I only like to do things that give great results. I'm not interested in poor results. So that type of patient I would not recommend for Coolsculpting if they have a large hanging double chin and thin loose skin who is a bit older. So it's really important to get the consultation from a great board-certified dermatologist or plastic surgeon for this area and not rely on the person at the Medi-Spa, because somebody could recommend it to the wrong patient, in my opinion. The other question I often get about Coolsculpting is concern about side effects, particularly the one bad side effect from Coolsculpting, which is called PAH, or paradoxical adipose hyperplasia, which is when the fat gets worse instead of better. And this is an uncommon complication. I've only seen it once over the years, and if that happens, basically liposuction is indicated to fix it. So let's use that as a segue to talk about liposuction. I'd like to state here that I do not perform liposuction, but even if I do not perform a procedure, I like to know about it so I can do a full consultation for my patients and refer them out to discuss other options if that is indicated, and this is one of them. Liposuction works great in this under chin area. Liposuction is physically removing the fat with a low-risk surgical procedure. The advantage is that it's usually a one-and-done situation, whereas Coolsculpting often has to be done more than once to achieve the desired effect. In addition, there's a bit of downtime from liposuction, and it does leave small scars, but it works better than Coolsculpting for large fat pockets or someone who just wants to do one procedure. So for this, I would refer out to a great board-certified plastic surgeon or a great board-certified dermatologist who is specially trained in liposuction. Again, not a Medi-Spa. This is actual surgery. And the last choice to treat a double chin is Kybella, which is an injection done in a quick office visit. It is FDA approved. It dissolves the fat. I will use this as a first-line therapy for someone with a very small fat pocket. It's too small for either liposuction or Coolsculpting. We will start with Kybella. Or I will use Kybella as a secondary treatment after Coolsculpting has debulked the area and there's just a little bit left, or if someone sometimes is a little asymmetric. Kybella works great. And the method that I use to inject it, it does not hurt. Although if you do not numb the area, it can cause discomfort and burning. But I numb the area and patients really don't have significant pain with the injection. However, there can be real downtime from it. There's definitely some bruising from the injections, and it can get very swollen. And the swelling can last from days to weeks. So I will often recommend to do it in the winter when the patient can wear a turtleneck or a scarf to hide the swelling. It's almost always going to be more than one treatment, and we will wait a few months apart for these, about 2 to 3 months for best results. The area under the chin when it has the Kybella injection can be a bit sore and feel a little jiggly and lumpy as the fat is dissolving. This is normal. As long as the patient understands and can tolerate it, the results are great from Kybella. So in summary, if someone has a double chin that they want treated, it's best to get a consultation with a great board-certified dermatologist or plastic surgeon that is familiar with the options. Coolsculpting works great. There is no downtime. It sometimes takes more than one treatment, and we need to be careful not to do it on someone who's going to have loose-hanging skin. Liposuction is surgery. Creates some small scars, has some downtime, but it's a one-and-done treatment for the most part. And that works fantastically for people with larger areas and who don't want to keep doing things over and over. And Kybella is an injection that works really well. It almost always takes more than one treatment and can cause some swelling. I like it best when the fat pocket is small. I hope that this was helpful to give you the basics of the understanding about the choices to treat a double chin. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.